I love that we're bringing in a keynote that's not physical therapist. I think the outside perspective from other professionals is so important. I think sometimes we don't know what we don't know because we talk to PTs, we engage with PTs, we collaborate, we do research, and I think it's really cool to have someone, who's not a PT provide their perspective and their experiences.
Hello, Megan. Hello, Amy. How are y'all doing today?
Good, Derek. Thanks for having us.
Yes,
Absolutely.
great.
Well, you're having me too. So just so
We're
we're all
coordinating.
clear, this is a triple hosted event with no guest. We're all just guests and hosts. So, but Megan, I know that you're our AOMPT president, and I think it's really cool that you've taken on the opportunity to also be a part of this and really being part of branding and things. So if you maybe you can give your introduction first, and Amy, you can go as well with being an executive board member, and also being one of the hosts here. So Megan, I'm gonna kick it back to you because I gotta stop talking.
All right. Well, I'll take it for now. So, Megan Donaldson, and I'm president of AOMPT. I'm also a department chair at Medical University of South Carolina. And so I've been a part of PT education for quite some time, still a clinician doing mostly pro bono work. And obviously, I'm a mom of two kids and staying pretty active with all the things that they do. So, when I got asked to do this, we absolutely had to say yes because manual therapy is part of the passion that we've had for so many years. Obviously, serves the AMPT organization really well. And I'm excited to talk a little bit about it and maybe why this is so important for us to do this adventure together. So that's a little bit about me. Amy, how about you?
All right, all right. So Amy McDevitt, I am a member at large. So I'm on the executive committee also at AMT, which is a great position. I get to kind of represent membership and what's happening there. I also get to be involved in bylaw changes, which is really exciting. We always hope that we don't have more than a handful every year, but you never know what's coming down the pike. So I am an associate professor at University of Colorado, so I'm in a teaching position. Clinically, I work in an outpatient clinic at the University of Colorado Health, so I dabble in the clinical world, and then I also do some clinical research, so I get to wear that hat too. And I'm really excited to be here because I think part of what we've decided to do is interview all sorts of people that historically have been part of the organization or maybe are new and are really change makers in the organization. And we want to be able to cover, a whole plethora of topics that we think are going to be interesting to the listeners.
Absolutely. And I even think this next piece, which is Derek being conference chair, needs to talk a little bit about maybe why he's interested in participating in this and how a conference could benefit.
Yeah, absolutely. And I'll just give my quick introduction as well. I'm an assistant professor at Duke University in the Doctor of Physical Therapy division. I've been a physical therapist for, how when you select how long you've been a member of the organization, I think, it starts out like 0 to 2 years, 2 to 5 years, 6 to 15, or 6 to 10, and then 11 to 15. And then there's like this, I think there's a 20 and up category, and it's just for like just the rest of everybody else. I think I'm in that category now. So, um, but I've been a PT for a while, but I've been in academia for 8 years. I do serve a little bit of clinical practice, specifically with mentoring, and I had the opportunity to mentor some manual therapy fellows, especially in this last year with our program. And so that's part of what I do professionally. And then within the organization, yes, I am the conference chair, was previously on the executive board as well. In Amy's role, which I don't think we had as many bylaw changes until Amy came on. But,
Thanks,
so,
Kurt.
but in the conference chair role, and yeah, really excited about this because I think this brings us another opportunity to highlight things that go on at conference, that go on before conference, that go on after conference. It lets people continue to live in the world that, if anybody's been to one of our conferences, really, I think that's where they start to get energized and rejuvenated about what we're doing in terms of our professional career and our goals and such. And when we have something like this, and as Amy said, where we can bring in guests, people who are sort of legends and lores of the profession, but then also bringing in those that are those new and upcoming talents and highlighting people. I think this is a really cool opportunity. That's been a while that I think we need to take on this challenge, and looking forward to it.
Yeah, and Derek,
Yeah.
you've done a great job in bringing so much energy to conference. I mean, and I'll just say I was in that former role, but you take it to a whole nother level. So this is great to have you here and doing this and taking what we bring from conference just to a different medium, right? Like it's to reach audiences that it's not just a single week. It extends over time. They can hit us pretty much any day of the week if once we get to full scale. This will be
Yeah.
great for those audience members. And to me, this is part of our strategic plan. We absolutely want to engage with our membership and I don't give them something back. I mean, obviously they've been members for a long time, but we also want to make sure that they can feel like there's resources that they can plug into and know that we have those resources, that we're building those resources. So that's a goal I know that as a board we've put this forward to do, and this was one of the mediums that we wanted to do it. So we appreciate you and Duke and Chad Cook for allowing us to kind of have this opportunity to transition with CMET's, hands off, hands on, hands off podcast, so we can get this to our audience as well.
Yeah, and I think it aligns really well with AOMPT and the strategic plan that we have. And it's nice to see this a little bit more formalized connection between the two endeavors. Well, not with the endeavor and then with the association.
Mhm.
The mission for the Centers for Excellence in Manual and Manipulative Therapy is to provide, I think it's really this balanced and honest, credible information about manual therapy. And what better avenue to do that than to have a podcast that brings in people who are, can speak to sort of both sides of the aisle really nicely. So I look forward to bringing in some of those guests. That's kind of what we've tried to do with some of the conference programming as well.
Yeah. And I like how we've kind of decided as a group here to engage, people on topics that aren't just maybe specific to manual therapy research, but I love that we're thinking about clinicians and bringing in clinicians that have ideas related to the topic. We've talked about maybe bringing in some people who have some expertise in education, because I think a lot of us wear different hats, whether we're clinicians and educating students or residents or fellows. We can always glean more, insight and information from people that are coming in talking to us about how to be better educators. So I like the kind of draft lineup that we have, that we're not going to disclose just quite yet, but I think we have some good ideas about the types of people that we're going to bring in to share ideas with us.
Yeah, Amy, I'm glad you brought that up because I think it's nice for the probably the majority of our membership is not researchers and educators, right? The
Mhm.
majority of our membership is clinicians. And I think making sure that we always have some sort of focus within that. And I think having a chance to bring in clinicians, one thing I actually have always thought that AOM has done really well, that, we have high level researchers at, some of the highest level of research funding that are part of our membership, but we also have very impactful, well-known clinicians who, many of our members have learned from it. And when you think about who we are with the fellowship training, it truly is a clinical fellowship. And so I
Mhm.
agree, Amy. I think having, making sure that when we bring in guests that we're always considering, um, you know, that part of it as well, not necessarily translating all of these evidence from the researcher, but also bringing in the clinician who is, using some of that.
Yeah. Yeah. I think that's great. And we all started there. That's that for all of us, those were our roots. And so I think it's great to try to give clinicians some palatable information to take back to the clinic, whether they practice just clinically or whether they educate in the clinic. And I still think what's neat is bringing in people to talk about education. It's not just necessarily education of peers and colleagues, but education of patients too. And so, I think there's a lot of different avenues that we are willing to take with us, in order to just bring in a diversity of speakers to give us a diversity of information.
And Amy, I love the fact that we even went outside of the US, right? Like our goal as an organization, which is a member organization of IFOMT, is for us to have that international flavor and perspective at times. I think it makes us better. And so for us to look at speakers and really be mindful about who can we
Mhm.
pull from the US and who can we pull from outside, because
Yeah.
this medium allows that rich engagement. And it's not about, oh, can you make the week work? Can you travel? Can you leave your family? Because I mean, let's be honest, if we're really looking at how do we do this space where we can engage with each other, it has to fit in our life. And so
Yeah.
we're trying to find ways to do that, whether you're a mom, a dad, or whatever. You got to make sure that it can fit in the life. And so, really, this is a great medium for us to be able to line up amazing speakers with some flexibility, right? That bring that
Right.
international flavor, experience, expertise. And to me, this is a priority because it helps our professional development of all of our members. And so, obviously, carrying kind of that international feel with a little bit of a hometown grown feel, by having some of the locals that they know of AOMP doing some of the facilitating.
And Megan, I want to say I really appreciate the fact that you're putting yourself out there as the person who's going to interview the international speakers at 2, 3, 4 o'clock in the morning. I think your commitment is just unbelievable. I really appreciate
Oh,
the fact
but
that you put that out there, to be the front runner in doing those late night interviews.
Well, I
Yeah,
don't
but
know though,
Amy,
because isn't
I'm just not sure. Yeah, isn't Amy our international traveler? I mean, like, I really
that's
feel
right.
like I should give this up. I mean, like, I feel like this is really your space, Amy, and I'm just, I'm excited to just, watch you grow in that platform. So
Thanks. Thank you.
feel free to
Mhm.
take those early morning calls.
Well, mountain time is probably the most flexible time. But
Is
I
that right?
agree, like,
Yeah.
the international stuff. But you could also do like the early morning instead of the late evening for
Mhm.
those recordings. But
Mhm.
speaking of international, I just, because I know and I don't know. So for our listeners out there right now, which right now we currently have none because this is our very first recording, so we're just saying this in this moment. But
That's
hopefully, as
great.
we do this, launch this out, we will actually have listeners, and we'll see when this on actually gets pushed out there. But when we're recording this right now on June 17th, is that right? I think it is June
Mhm.
It
17th.
is.
And I would imagine that this will get published after the big event that's coming up in early July. And Megan, you spoke to this just a couple minutes ago about the international presence and the international, appreciation that we have. So, what besides the Taylor Swift concert that I think you may be
All
going
right.
to or
All right.
not? What else are you excited about this IFOMT expedition that we're going to be headed out to? And I think maybe your first IFOMT, right?
Yeah, this is my first iPhone, so I'm just timing of the other ones. I was never able to make it, so I'm really excited about this. So, I think so let's put it into context. So similar to AOMT, right? It's multiple days. There's some early sessions, like there's some optional things to join into, and then they do a little bit of a celebration. So that's all really similar. There's a teaching seminar. So again, for those who are kind of in the education space, mentors, maybe serving other fellows, right? Those are opportunities to plug into those other who are doing that across the world. So that's really kind of cool. There's rich conferencing. I mean, again, I think the biggest thing for me is this is a networking event internationally. So what the expectations are, I think it can be as much as you want or as little as you want. It just depends on how much you want to engage in those things. So to me, this is a space that we're taking our board, and we're ready to go and meet and talk with people and really figure out best ways so we can work together and leverage manual therapy on this platform internationally so that people really do get a sense of what this is, and kind of again going back to what CMET was there to do. It's to remove the misnomers. It's the
Mhm.
misinformation that has been out there. We need to talk about this as a great viable option. And I think the pendulum swings pretty good, especially in orthopedics and PT specifically. But within orthopedics, right, we've kind of gone to this exercise, pain science, and we've kind of forgotten a little bit about the benefit of manual therapy, or it's been criticized. So this is a really nice place because the U.S. has stand pretty firm, and we still believe in those supports and the multimodal approach.
Mhm.
So to be able to
Mhm.
go out there, when I say out there, I'm saying Switzerland. We're going to Switzerland, and we're going to have these conversations and with researchers and speakers. And yeah, I really couldn't be more excited for what we get to do.
So Megan, aren't you excited that we're going with Amy though? Because I actually feel like Amy's are going to be our traveling mom. Because I have absolutely no freaking idea what to do in terms of traveling. I've been to Jamaica and I've been to Canada. And when I say Canada, I've been to Beaver Creek, Yukon territory. So not just like Toronto, like I truly have been in Canada. But that's it. Like that's my
Yeah.
international traveling, right? So I'm super happy to have Amy. Amy, any advice for us, like, make sure
Hmm.
like, we don't do anything stupid and or what.
I'm happy to be your guide. Yeah, I'm excited. I love traveling internationally, and here we go again. I just got back from an international trip, and I actually just left the suitcase open and pulled out the essentials because I'm packing it back up again in a week. So, but it'll be great. And I went to the IFOM conference in Glasgow, which was. Were you there, Derek? In
No,
Glasgow?
but I was looking at that. Wasn't that like 7 years ago, 8 years ago
Yeah,
now?
eight
Because we had a
years.
Yeah,
COVID
yeah.
break.
I can't remember the exact year, but it was really interesting. I think one of the things I enjoy about it, and hopefully we can bring some of this back to the podcast, is just learning about what's happening in other countries, what's current, what's contemporary, and also what I think is important is learning how to kind of cater to different populations of people. So we'll be privy to presentations from people representing countries all over the world. And it's just really fascinating to hear how manual therapy is slightly different or
Mhm.
it's modified, and what ideas come from not just researchers but clinicians in other countries. And so I'm excited to bring some of that back, and maybe there's some speakers that we're lucky enough to hear at iFound that we can think about bringing to the podcast. So I think we're also there on a little bit of a fact finding mission to bring some really cool information back to our membership and our listeners. So I'm excited about that too.
So it's not just fact finding. I can speak specifically. We are getting mics,
Yeah.
and Derek and I have to figure out how to use these mics. And we are going to go navigate wherever we are to go and have live conversations and bring it back. So, like, well,
Yeah.
we're going all in this. Yeah, we're all in.
Okay. Okay.
I gotta. I hope I don't get in the security lines and customs, and they think that I'm some spy. If you don't see me ever again, somebody thought I was a spy. And so obviously with my mics or whatever else is be in my bag. But Amy, we're not on a fact finding. We're going to find them and
All
we're going
right.
to interview them. Real live
So it's,
time.
it's an implementation. It's an implementation trip.
That's right. That's
They are
right.
little creepy mics. I think they're little like fuzzy feathered mics that we're supposed to wear on our shirts, and I think like talk to people and get
They're
information.
going to think I'm a
So
spy.
you're a little bit like a spy.
So
Oh.
Amy's
Derek,
not
what
doing that.
what are some of the Derek and Megan? What are some of the ideas that we want to share with listeners about some of the speakers that we might be bringing forward in the next part of 2024? Do we want to
That's
do we want to talk about any like categories of things
yeah.
we're going to be talking about, or maybe what are some of our goals to in terms of engaging with different speakers? I know we talked a little bit about that already, but what do we want to share with people without totally spoiling it?
Well, I'll give big categories, kind of like the big overarching
Yeah.
thing. So like in our strategic plan, right, we have key enablers that kind of make everything work that we do. And when we think about that, it's leadership, it's education, and it's advocacy. And I would almost suggest, the research piece in that kind of transcends. It kind of goes across multiple, like it could be an educational piece, right? Just how to clinical pearls and those kind of things.
Yeah.
But really, those are the three big overarching aims. Like, right, we're trying to lead and grow as an organization and be the front leader. In order to do that, we have to have enriched membership that just really feel connected, and with these speakers we feel that will happen. From an other perspective, it's just the education side. I mean, I think we have great topics, right? Pertinent
Yeah.
topics about manual therapy, integrating manual therapy across multiple populations. Whether I even saw some of the lists, like we were thinking about, do we bring some pelvic health in here, women's health, right? So some of those pieces and topics would have a really nice platform, which is just contemporary practice. And then the last is advocacy. And I have to say, guys, the more I'm at the main level of leadership and interfacing both nationally and internationally, we have to be an advocate for the science and the practice of manual therapy.
Yeah.
We have
Yeah.
to.
Yeah.
And this is the platform that it has to be at, because not just on our conference, which is these, days together, and we feel so good because we're all together and it's a little bit kumbaya, to be honest, right? It's our
Yeah.
family, but it's when we leave each other, how do we keep the synergy and how do we keep advancing the profession? And, Twitter's got a place. All the other social media things have a place, but how do we stay connected where we can follow thought leaders more than in a snippet? They can be misinterpreted, right? I mean, more than something. This is a great forum for that. So we've aligned some of those speakers on those categories, and so
Yeah.
I'm excited about that.
I love that.
Yeah, and to jump in there, I'm also excited that I don't know if we've mentioned this, but a lot of this, Megan, Amy, and I, at least I'll speak for me. I don't know a whole lot about podcasting. We launched the Hands off podcast, and I think we've done an okay job with that. But we have brought in Jimmy McKay and his team to help us with this, and I think that is what I am most excited about, because I think he's going to really supercharge what we're going to do and really help us bring something that's a little bit more exciting, a little bit different. And actually, before we even got on and started recording this show, we were having all kinds of fun playing around with the StreamYard thing that we're working with. And I think that's all part of the fun of us learning how to better engage and interact with some of these people that we're going to be bringing on, because I'm sure that we've all heard podcasts. It doesn't matter how great the guest can be. If we're not doing a good job of engaging that individual, then it may not be pertinent to the listener. So I think that's going to be a fun and exciting thing. And just, your question about like what kinds of topics and things that we're going to be bringing in. I mean, I'm just looking down some of the lineups here, just talking about everything from, careers in manual therapy, to Megan's point, some of the more interesting things of where manual therapy can be put into manual therapy in sports, manual therapy in pediatrics, other sorts of approaches, and then myth busting and all kinds of fun things that I think we'll be able to do. And from there, you know selecting the right guest for that. But then I also think too we'll also have guests who will probably let us evolve a little bit of what we're talking about in addition to
Yeah.
that. That's one of the things that we did at the Centers for Excellence in Manual Manipulative Therapy. And I don't think it worked as well as it's going to, because I think we're going to get some good advice from Jimmy, but having some themes. But obviously we need to have, some big stars. We're going to have a lot of heavy hitters. And I think, with the international opportunities and all of the international people that Amy will interview at 2 a.m., we'll have some really good guests as well.
Well, and I love the platform with that, because if you know Jimmy, which, right, he's got that personality and that kind of get to know you person type. And I love that about him. And I think that's really nice about this platform too, is that we can get to know each other a little bit differently. Just, what about them makes them a little more unique, right? Rather than just, oh, they're a researcher, oh, they do that, or oh, I'm my bio, right? Like I'm so much bigger than that and different than that. That's not even half the things that I want to talk about, right? But
Yeah.
it is who it makes part of you, right? And so I'm looking forward to getting to know a little bit more about the people that we're going to speak to, and learning about their experiences, right? And what learned lessons our audience can learn from them, because like I learned so much by learning from others, and honestly the things that they wish they wouldn't have done, or the things that they think they should have done better. And it's a great space for us to engage in that too.
I think
Yeah.
they're kind of like you brought this to conference, the PTI talks.
Hmm.
Always loved those, just because they allow people to, get into somebody's life a little bit differently than just here's the research path that we took. And then it seems almost untouchable to a
Hmm.
lot of folks. I think when people see that, their journeys involve a lot of other very important parts of their lives, their families, their hobbies, and things like that. I think that also makes it really fun and interesting. At least I think so.
Yeah,
Yeah.
great.
Hey, Derek, do you want to tell people a little bit about the hands off, hands on? Are we hands on, hands off, or hands off,
Hands
hands
on,
on?
hands off.
Hands on first.
Hands
There's a
on
reason.
first. Okay.
And then pull away. Yeah. All right. That
Yeah.
that makes sense. Yeah, we're good.
No, but I think it'd be good to tell people a little bit about what's in a name.
Yeah, no, that's a good. Well, gosh, we were going around and around about a name, weren't we, for this? And I think when we had the hands-on, hands-off podcast, and when we were starting to talk about our name, we were talking about the strategic plan. I'm like, wait a minute, we're going to be saying the same thing, we're trying to do the same thing, and we're speaking in parallel. So why don't we just put all of the energy into one direction? And so hands-on, hands-off podcast really was identified as a good name within the CMET, because I think there's a lot of misinformation about manual therapy, and it drives me crazy sometimes when you see things about the misinformation. And it's a type of manual therapy that we would all probably agree maybe is not necessarily the most appropriate. And so hands-on means that there is time that, yes, that it is necessary to put our hands on patients.
Mhm.
But then there's also this component of manual therapy that, we also don't need to put our hands on the patient to be effective. And I think that's one of the things, at least in my fellowship, when I talk to a lot of people who have gone through fellowship training, is that one of the things that they learn through fellowship training is more about when to put your hands on and when to
Yeah.
take your hands off, right?
Yeah.
And more
Yeah.
often than not, you are taking your hands off, but you're still using, and you're still effective with it. And so that's, I think, the idea behind the name is that manual therapists will put their hands on patients, but they will also spend a lot of their time, in fact, probably the majority of their time, with their hands off of the patients, right? Doing
Yeah.
all kinds of other things. And a part of that reasoning of going into when you put your hands on, when you take your hands off, is part of the journey that we have all evolved in, and have grown through our respective programs. And I think that that's something that we would all agree on. So I think that hands on, hands off podcast name was very intentional, because we wanted to make sure
Mhm.
that there was times where we said, yes, it's appropriate for hands on. And then there's also times when it's appropriate that it may not be for
Yeah.
the type of
And
hands
I
on.
like that. I think some of the misinformation out there is that we only do one thing, or that we condone just this one intervention, which couldn't be further from the truth. So I love hearing you unpack that a little bit, because I think, we're also trying to just improve our branding, our people's perception of what it is that we actually do. And a huge component of that is therapeutic alliance and shared decision making, motivational interviewing, all those other things that really are a hands-off component. So thanks for giving us a little bit more of an explanation of that.
Yeah,
Yeah.
and I think that we've put that in those lineups too, right? How does that work in the building those relationships and person-centered care, patient-centered care? I mean, all of those
Yeah.
components center around the patient. I mean, so and sometimes patient preferences, right? I mean, if they think that that's something that's going to get them better and that's what they're looking for, then that's a great place to start. But then obviously use your reasoning and moving on. And I think the lineup helps us really kind of just convey the flexibility of a manual therapist who's gone through, especially for fellowship training. But it's not to say that fellowship training is the only thing. I just think
Right.
it's a style, right? It's the way that our organization feels that manual therapy, when done at the highest level, it really integrates all of the pyramid, or all of the stools of the or all the legs of the stool, in order to really integrate it for the best outcome for the patient. And I think that's really important.
Mm-hmm. Well said.
Well, really, Derek is the one doing it. I'm just summarizing, and you already obviously hit it too. So three. This is why we should just do all three together. So Derek needs to be pulled into these international 3 a.m. meetings as well. But he's probably running a track somewhere, chasing his stellar kids. I mean, that's probably what's really happening there. So
No, I'm getting too old for those 3 a.m. runs. It's like that knee arthritis starts to kick in. I gotta grease the skis a little before I get running. So
oh, well, tell me this. What do we get to think about in what's coming up in Orlando that you're most excited about for our own
Oh
conference,
yes.
right?
Please.
Like, we're not that far away, and Derek, things are opening up soon, right? Like, I mean,
yeah,
registration's starting up. I mean,
it's
we should
open.
do a whole show just on that, but just give me a little snippet. What do you
Actually,
think is like the most exciting, or what are you most excited about?
yeah. Well, obviously, when this podcast gets released, it's open. Registration is open. It's actually, you can go on the website and you can register. So we are super excited. One, we're in a really cool location. We're in Orlando. We're a really nice facility. The facility is exactly the type of facility that we want to be in. What I think AOMP does really well, and in those kind of spaces where everybody is together, like we're all in the
Mhm.
same house together. And it's a really nice space. If you get a chance, book your room. The rate is amazing. That kind of thing. So take time to come down. I think one of the things that I love about conferencing, especially because we're just we're pulling out now of a pandemic, we're all getting an opportunity to come back together. And it just shows and it proves how essential and how important it is for us to be together. And so having a space like we're going to have is going to be absolutely incredible. I've looked at pictures of it. It's top flight. And we actually just surveyed our membership. And one of the things that we realized is that location matters for our
Mhm.
conference.
Mhm.
The zip code actually does matter. Obviously, the convenience of the airport. And so I think this checks a lot of those boxes. Beyond that, what we're super excited about is, and I think the thing that I was most nervous about when I took over from the previous conference chair, who set the bar incredibly high, and I'm just hoping I don't knock it off too hard, is uh, the obviously the level of keynote presenters. And this year was and then Megan, I'm pretty sure that you always felt this, where you start to get a little stressed out, like, am I gonna get? But we ended up getting three really, really good, actually, I should say four, but three keynote presenters. Jeremy Lewis, if you work anything with the shoulder, you know who Jeremy Lewis is. I mean, he is going to be somebody, I think that, and to be honest with you, we had him on our Hands On, Hands Off podcast, which is how I ended up connecting with him to get him to come to conference. Because
Mhm.
after I interviewed him for the podcast, I was like, this guy has to come to conference.
Yeah.
He's so inspiring, so motivating, such an incredible, and I think he will be a lot of fun. He's going to be a lot of fun. People are going to really enjoy that hour and a half of
That's awesome.
his talk. The Nathan Hudding, he's a friend of ours within AOMPT. He has come to AOMPS before. He's a huge supporter of what we do. He's a huge supporter of manual therapy on the international stage,
Yep.
and specifically to neck pain management. And so I'm super thrilled that when we asked him if he would be, he was just like, I've been waiting for you to ask me.
Oh,
So
I love that. I love
happy to
that.
have him. And then Sarah Piva, obviously a very established researcher with UPMC, and she is interesting. She does a lot of work with knee and knee OA right now, but she's kind of, previous to knee, she worked a lot with low back pain, and now she's kind of moving back toward low back pain. But in our conversation, she was like, I was once a manual therapy fellow, but I let it lapse. And then we were like, no, wait, you don't have to worry about
That's
that
right.
now because we don't have the 10-year rule. And so I think we're even able to bring her back in to the fold. But she comes
Awesome.
with a surprising background in manual therapy. I didn't realize that when I started to reach out to her, and then we started to have some conversations. So it goes to show how like AOMP can jumpstart so many people's careers into so many different
Yeah.
directions.
Yeah.
She'll bring a lot into that. And then Roger Chow, I mean,
Yeah.
this is going to be an incredible, distinguished lecturer. You
Yeah.
couldn't ask for a better lecturer. He's going to be our first non-physical therapist as a distinguished lecturer, but he is somebody who probably, if you look at the research line, a lot of the things that come back to conservative management for low back pain is, probably one of, if not the most arguable persons who's really sort of shown how we're not doing a great job of managing low back pain from a medicine and healthcare, and how
Yeah.
physical can be a part of that solution. So I'm excited to hear what he brings into the table. I've actually had a chance to hear him once before speak, and it was definitely a one of those crowd appealing events. It was exciting, and
Yeah.
he's a good speaker. So I think those are the exciting things. And then the last thing is we just finished reviewing the proposals, and I was excited because the majority of these proposals they're manual therapy. People
Yeah.
love to present about manual therapy, and we're going to have a lot of really diverse uh, types of presentations that will go along with our keynote presenters. Everything from pelvic health, pediatrics, sports, to the typical things that we would see with chronic pain management and so on. But the overall quality, we were saying on the other night when we were going through the conference proposals that this is hard because they were actually too good. So there was not enough distinction in the scores, and so it was a little bit of a challenge to get these to figure out what was going to be best, which is a good challenge to have.
That's
Yeah.
awesome. That is
Yeah. That
awesome.
sounds great. And I love that we're bringing in a keynote that's not a physical therapist. I think the outside perspective from other professionals is so important, because they have a lens. I think sometimes we don't know what we don't know because we talk to PTs, we engage with PTs, we collaborate, we do research, and I think it's really cool to have someone, who's not a PT provide their perspective and their experiences. I mean, I'm really excited personally that he's coming. I've been reading his work ever since I kind of entered academics, and I
Right.
quote his stuff all the time. And so I'm, I kind of feel like I have a little bit of like, I'm starstruck.
She's, yeah, I
Oh
was gonna
my
say she's starstruck, Derek, because she's
All
giving.
right,
She's
so
like,
Amy, don't worry. I'll
I'm like
reserve a
getting
seat
out
in
of
the front
there.
row for you. I'll leave one there for you. Yeah.
we
My
gotta
friend
get her a
Roger.
shirt,
This is
Derek. We
Amy,
gotta
but
get her a
Amy.
shirt, and that he can sign it for her. Oh, we have to do something. Oh, guys,
Or
for
I could wear a
listeners.
bracelet, WWRCD. What would Robert Chow do? Roger Chow
Oh my
do?
gosh, you're giving all the listeners all these ideas now that they're
I
gonna have to
know.
tell
I
us what we're gonna
know.
do. Yeah, that
Yeah.
could be a fun competition. Whose idea do we take? I'm just saying, Derek,
Yeah.
we might have to explore this a
I'm
little
trying to
bit.
figure out
So.
if we save Amy a seat in the front row or we actually don't have
Oh,
Amy in the
Derek,
front
no,
row.
like
I don't know
you and
what's
I
the
are in the
right thing
front
to do
row.
with
Amy's
Amy.
gonna be like trying to nudge up there. We'll be like,
Is that
Amy,
the
go
risk
sit
of
back.
embarrassment that you're trying to put me in the 10th row?
No,
That's a real risk, just so you know. Yeah, I'm
Right.
excited Roger Chow's coming. I think it's going to be
it's gonna be
fantastic.
great.
And uh, all the other, people that you mentioned that are in the lineup, I think it's going to be great.
Hmm.
Yeah, well, I just have to say kudos to you, Derek, for putting the lineup together.
Yeah.
It is hard to put such top-notch people year in year out, and bringing that to the AM group is it's a privilege, right? I always think it's such a privilege to have that opportunity to do that work, but it's also hard work. And Derek, you're really going out and getting those speakers, and so again, thank you so much for all your work you're doing there. I mean, we really, our organization is for the people by the people. Like that's it. Like we're doing this work for our people. But AOMPT is just been such a great organization to be a part of from very very long time ago. So I love
Mhm.
seeing that people still have the passion to serve with such a big heart. So thanks, Derek, for that work.
The other thing I'll say is that it's actually it's a little bit of an easier job than I thought it was going to be. I know that doesn't sound right, but in that, and I say that because AOMT is a very respectable
Yeah.
academy. It's a very respectable organization, and so when I reach out to people, they want to be a part of that. They know who our membership is. They know our members are some of the not just the great researchers and education and educators, but they also know that they truly are like some of the best clinicians. If you think about this, like who would I send my mom to go get care for? And if I saw somebody
Right.
that had, some background in manual therapy and such. And so when we talk to folks that want to present, they know that they're presenting to an audience that has high standards. And I think
Mhm.
that makes it a bit of a nice role because I think people actually feel it is a privilege to stand up on the main
That's right.
stage and to present to this group of members, clinicians, other researchers, and educators who have these standards of excellence that are, quite high.
Yeah, well, I think we're also just, it's a pretty fun group too. By the way, we have a party every year. Yeah, and they're pretty crazy people. We enjoy each other's
They
time.
are. We just got to watch Amy and Roger apparently though at the party, so please make sure that we'll give security a little bit of a key, like
I
make
love
sure.
it. I love it. Well, I mean, again, we have such awesome people who come to these conferences. So I always say it is like a star event, right? You get these rock stars in the profession who totally make time for other people, have conversations. So Amy, you can be the first to have that conversation with Roger, and I'm sure it'll all work out great. But we'll have others, so we'll
Hmm.
distribute all the rock star dust around the room. Make sure everyone gets to spread around. So
That's
it'll be
it.
great.
So,
Awesome.
Cool.
I think this is pretty good for our first kickoff. I mean, we hit our vision, what we're trying to
mhm.
do. We totally
Yeah,
talked about how it aligns with what we're trying to do as an organization. You gave 'em a little history about the naming, which, by the way, not an easy thing. And thank goodness for Derek saving the day.
yeah,
Now we're sitting here at a space where we get to talk about what our next steps are. We've got a lineup. We've got a huge lineup. We're
yeah,
going
yeah,
international, and some of those same people are going to be on the main stage with you, Derek, as we're kicking off big conference that we just talked about. So I think this is a pretty good wrap up for all the things that we've got going on that are going to come over the next 5, 6 months.
I
yeah,
think it is. I think it is. Yes, very excited to be a part of this, and and to our listeners, actually, just when we said, "Hey, what's our first show that we should have?" I'm like, let's bring Megan and Amy on the show and let's just have a conversation because it'll,
Let's talk.
it'll be about the best thing. We didn't play around with any of the technology, though, did we? We could have had all kinds of fun with some of the sound bites for our listeners and things, but
We'll do
we'll do that
more.
another time.
We'll do more. I can remove myself now. I can just go and just
I know.
yeah.
Irish goodbye you all. So,
You
we,
can, but I also have the same amount of control as you do, and I
you
can
can
bring
put
you
me right
back
back.
on the stage.
I don't think we're going to showcase all of our inadequacies this early into this endeavor.
I
So,
agree with Amy, and two beats one.
All
Aw.
right.
Well, thanks, team. It's great. I really appreciate you guys going and doing this with us. That's awesome.
sounds like that's a wrap.